Today, I'd like to talk about one of the most challenging issues on our contemporary scene, and that is the issue of abortion. We've seen a lot of developments recently. We've seen the Supreme Court decision basically throwing the issue back to the individual states to decide. We've seen some states pass restrictive laws. We've seen people in those states kind of rebel against it and vote for a different set of laws that allows more freedom for women. So where does this put us in terms of the Catholic Church and our position against abortion? Uh, what are some possibilities for us going forward in this very challenging, very difficult atmosphere? Well, some of the responses to this have been on getting to the root causes of abortion, why people have abortions, and trying to alleviate those so that there are certainly less abortions, which from our point of view of Catholics, of the Catholic faith, we would prefer that, of course, there be no abortions at all, but certainly less abortions is a victory and a way to go because of the sacredness of human life from the very moment of conception to natural death. So to try to get at those root causes is sometimes very difficult and requires a lot of effort. A lot of the effort on the part of the church seems to be on political solutions. But as we look at the political scene, there is division, there is discord. It's difficult to arrive at a political consensus. It seems that when you look at the overall polling, most people in the country prefer sort of a moderate position on abortion, that there should be some freedom, of course, for women to make that choice, but then there should be some restrictions. So, as Catholics, what can we do to get at that root cause of abortion? And I'd just like to talk about two initiatives that could perhaps help us uh, going forward in terms of this very complex, multi-layered, and challenging issue for all of us. First is parish-based programs. Example is the Kansas City area parish. They helped a woman who was thrown out of her roach-infested apartment. Her landlord had confiscated all her belongings. She had 3 children. She was pregnant with a fourth, and the parish reached out and helped her and gave her support, and this enabled her to successfully complete her pregnancy. A recently widowed mother needed help with some of the hard work around her house and some respite help with her adult daughter who is on the autism spectrum. Help came from Queen of the Holy Rosary Parish in Overton Park, Kansas. They provide 5 meals to any woman in the parish boundary who has recently given birth. So again, this is the parish reaching out to help this woman, to give her some assistance, and this, of course, was a great benefit to her and to her children. Walking with Moms in Need groups. It's a nationwide initiative of the U.S. Catholic Bishops' Conference. And it's a response to the image within the Catholic Church in terms of this, that the Catholic Church projects to others. And that image is that the Church is judgmental, that it doesn't really care about women facing crisis pregnancy difficulties or parenting challenges, that the Catholic Church just wants to accuse women of murder and shaming them with sin-based discourse, just to say that you're a sinner, you're bad, you've done this terrible thing. And that is the image that sometimes is projected of pro-life Catholics. So the key elements in this Walking with Moms program are practical and financial assistance and emotional and spiritual support. So if a woman is facing this rather difficult choice, should I continue my pregnancy? Should I have an abortion? And she lives in a state where abortion is allowed. What is she going to do? She needs help. She needs support. And so this program, Walking with Moms in Need, is an attempt to provide that support. Some of the criticisms of the program is that the program is it only window dressing. Should the church put its resources into structural changes that would help all pregnant women and mothers? There does not seem to be an influx of resources from the parish, from dioceses, or the USCCB central offices. As we saw earlier, there are these parishes in the Kansas area that are trying to reach out. But is this true of all of our Catholic parishes? How many parishes would be willing to embody this type of initiative to really help women who are in difficult situations? Walking with Moms in Need was launched in 2020, so it was launched before the Dobbs decision. It was launched with the idea that what we have to do as Catholics is really do more than just preach about abortion and talk about abortion all the time. We have to offer practical and concrete help to women during pregnancy and especially after pregnancy, helping them raise their children, helping those families. This program of the U.S. bishops is a decentralized program, meaning that it's up to each diocese, it's up to each parish to embrace it. So therefore, actual statistics are hard to come by. 75 out of the 194 dioceses have initiated the program. It is a voluntary program, as most programs in the church obviously are. This is something that is up to the diocesan bishop to embrace. It's up to then, when the diocesan bishop embraces it, encourages the individual parishes and parishioners to embrace this program and to really reach out and to help women in a very specific and concrete way. How does this program work? It works by, first of all, assembling a core team. And the core team gets together and they take an inventory of the local resources. What's available in the local area? What's available for women on an emotional level, on a financial level, and what physical help is available for women. For example, there are Catholic charities. There's the St. Vincent de Paul, Knights of Columbus, Knights of Peter Claver, Gabriel Network maternity homes, crisis pregnancy centers. Many parishes host baby showers, baby bottle drives, provide cribs, strollers, diapers. They provide transportation. They offer Uber gift cards for doctor's appointments. So these are practical, specific ways that parishes can help. There is, of course, controversy about crisis pregnancy centers that are established. They offer pregnancy tests, they offer ultrasounds, and they message against abortion. They, however, are largely unregulated. Many are faith-based. They received a lot of money from the government after the Dobbs decision. There are about 2,500 of these crisis pregnancy centers nationwide, and they operate under the guise of being a medical facility. So these crisis pregnancy centers can offer help and support to a certain extent through offering sonograms for the women, for offering counseling and emotional support. But the question we have to ask is, are the parish programs ready for the decades-long commitment that the family may need? And if you look at it, is it just for 2 months or is it for the 22 years? So this has to be a long-term commitment for these women, for these families who are in need. What are some of the challenges? Some of the challenges are changes that are needed in the food stamp programs, housing assistance, expanding educational programs for those under 6, addressing the crisis of maternal mortality for women, particularly women of color, and opposing the closure of labor and delivery wards. So these are challenges that we face along with providing that support. We have these health challenges really in many areas, particularly acute in rural areas. So the church, in order to offer effective support, has to provide this type of help for women who are in need. The future of this program really depends on Catholics. Will Catholics embrace this? Will they see this as a viable way to get to the root of an abortion, where many women feel they don't have a choice, unfortunately. They feel, my goodness, what am I going to do? I don't have the resources to provide for this child. So with this type of help available, and if this is established in parishes and dioceses nationwide, there would be a viable alternative for women to abortion, and hopefully abortions would be reduced and women would have that help, that assistance that they really need. Examples in our own area are Mama's House. And Mama's House was an old convent in Levittown. Young homeless mothers and their babies come. The chapel of the former convent is now a playroom with cribs and colorful toys. So this is a repurposing of a church facility. Women are between 18 and their early 20s. They're given life, parenting, and educational skills, which can lead to greater stability and permanent housing. So it's not just that immediate help. They're thinking long range. Well, how can this woman be helped in terms of raising her child? What type of job skills would she need? How can she get permanent housing? This is the type of help that the woman really needs for the future, for the stability for herself and for her family. We received a grant from Fidelis Care for $18,000 to improve maternal health. More than 1,200 women in the U.S. died in 2021 of maternal causes. Many of the deaths are preventable. So an example of Mama's House helping to provide the stability for the woman, where she has those resources and she can get the assistance that she needs, the medical assistance that she needs, and also the emotional support. The women are oftentimes in a moment of distress. They lack housing. They are pregnant. They have a young child. They're too old to be in foster care, so they're moved out of foster care, and they can't yet live independently. Mama's House has homes in Levittown, the convent that we spoke about, also in Glen Cove and Massapequa. The woman can get services for up to 2 years. Again, that would be a question. Maybe what if a woman needs a longer period of time? What help, what assistance can be offered? Again, for that walking with moms concept. Some of the women are getting GEDs. Some are working to get jobs, getting the skills they need for those jobs. And some are working on getting a driver's license, which in our area is so necessary because the public transportation many times is inadequate. The pregnant women are assigned doulas. There's a support group working to identify and assess perinatal mood disorders so that they can get the help that they need. Mental health conditions represent 23% of the cause of pregnancy-related deaths. So that emotional support is so necessary. That psychological help, that counseling help can really prevent deaths and really help the woman and help her thrive and have a good future. Transportation services are provided by Mama's House. So again, that's a big need that that woman would have to get to work, to get to educational opportunities, job training opportunities, to get to medical appointments, very important. An example of a woman in Mama's House is a woman with epilepsy. She can't drive, hard to hold a job when she couldn't drive, so she needs that support to get the epilepsy under control with medication and to get the transportation that she needs. So these are examples. The Bishop's program, Walking with Moms, the Mama's House network. These are examples of ways to get at the fundamental root of the abortion problem. Laws, as we can see, are very changeable, very controversial. But what is really needed, I think, and I truly believe, is the help for the woman who is in this crisis situation, where she can get the support, not just on a temporary basis, but in terms of the long-term skills, educational opportunities, and medical support, emotional support that she needs. I think it's a wonderful way to proceed on a very difficult and challenging issue.